This is my audience. SIDS is one of the many worries that every parent thinks about when they have a little baby. I'm sure we've all heard of SIDS before, but do we know why it happens and how to prevent it? When I first became a mother back in 2016 to my little boy, I barely slept for the first 6 months to a year because I was constantly waking up to check on him. Now the worry is back because I'm about to have another little boy in March of 2020. Even though we've heard of SIDS, some people do not know how to prevent it, what causes it, and even what it is. So what exactly is SIDS? SIDS is the death of an infant which remains unknown even after an autopsy is done. SIDS is the leading cause of death between the ages of 1 month and 1 year. Even though most times SIDS happens between the first month and the 4th month, and that is up to 90%. SIDS used to happen more often during the winter months, but now it seems to be gradually happening throughout the whole year. According to Gale Academy, prior to discharge from a hospital, a nurse must go over the required material on how to keep babies safe from SIDS, and this law became effective in January of 2011. Other names for SIDS that you may have heard of is crib death, cot death, or sudden unexplained infant death syndrome. Now that we know some facts about SIDS, what causes this to happen? A combination of physical and sleep environmental factors can make an infant more vulnerable to SIDS. Here are some statistics over SIDS. According to the American Academy of Pediatrics, approximately 4,000 infants die yearly without an immediate cause in the United States. More than half of these will be from SIDS. Out of all the 50 states, Alabama has the highest amount of SIDS, ranging in at 5 times the rate. Boys are slightly more likely than girls are to die from SIDS. 1 in every 3,845 infants will be at risk for SIDS. Rates have decreased by 66% since 1980, which is huge. American Indians and Alaskan Native infants have the highest rate of deaths. Preventing SIDS is 100% impossible, but there's a lot that a parent can do to actually help prevent this. Here are some physical factors. Brain defects can cause SIDS to be more likely. Portions of the brain that control breathing are not fully mature enough to actually help the baby be able to control the breathing. If a baby is born with a low birth weight, premature birth can cause it because the brain is still forming and does not have complete control over the automatic processes, such as breathing and lowering the heart rate. Respiratory infections, such as a common cold, RSV, bronchitis, and pneumonia can also cause a baby to have trouble breathing, which can result in SIDS. Some sleep environmental factors can be sleeping on the stomach or the side, sleeping on a soft surface such as a couch or a blanket, overheating such as wearing too many clothes or putting the baby in too many outfits all at once, co-sleeping such as sharing a bed with a father, a mother, a sibling, or a pet. According to an article written by Culver in December of 2014, SIDS is caused by co-sleeping or exposing infants to sleeping with objects, such as toys or blankets. Some risk factors that can cause SIDS is if the mother is younger than 20, they used alcohol or drugs during pregnancy, they did not receive prenatal care from their doctor, they have a family history of illnesses, or a family history of SIDS. Some ways to prevent SIDS is keeping the crib as bare as possible, having nothing in there except for the baby. Putting them on their back to sleep, putting your baby only in a sleep sack with maybe a onesie underneath, having the baby sleep in the room with you up to 6 months in a bassinet or a playpen. Breastfeeding your baby has been proven to decrease the amount of SIDS, and offering a pacifier so that they learn how to suck throughout the night. According to Gerber and the Bureau of Primary Health Care, letting your daycare provider know that you want your baby to sleep on your back is one of the main reasons why it can prevent your baby from having SIDS while they're at daycare. some unsafe sleeping environments, such as sleeping with toys or stuffed animals. Here, if the baby has bumpers, they could roll over and suffocate. Sleeping on their stomachs, they are not strong enough to hold up their heads, so when they turn and they're face down, they will suffocate because they cannot breathe. Here, a mother is sleeping with a child. Once the mother falls asleep, she cannot prevent the baby from rolling into her. And here, a baby is sleeping in a blanket. If the baby happens to roll over and put the blanket over their face, they are not strong enough or know how to get the blanket off of their face. But here are some safe sleeping environments, such as just putting the baby in a sleep sack with nothing in the crib and a pacifier. Here, the baby is in a swaddle, which has been proven safe to sleep in, and they are in a bassinet next to the bed. Same here. There is nothing in the playpen. They are sleeping next to their mother's bed, and they are also in a swaddle with nothing around them. Health is key. Get your baby's immunizations. According to the Nursing and Allied Health, if a mother refrains from smoking while pregnant, the risk of SIDS decreases because it allows the baby's lungs to fully develop. Do not allow smoking around your infants because it can cause them to not be able to breathe as well. Prenatal care, even before and after. Take your baby to their doctor visits and make sure that they have their checkups. If taking medications, you or the baby, make sure you know the side effects and when to call a doctor. Throughout this slideshow, I am giving you information on SIDS, the fast facts over SIDS, statistics over the type of death, physical and sleep environmental factors, knowing how and where to put a baby to sleep. SIDS is always in the back of a parent's mind every single time they have a child. Knowing what causes SIDS to happen and know how to prevent it will make the parents have a peace of mind. Here is my audience again.